Hello, everyone. This is Professor Dr. Mohamed Eldera, and I would like to share with you a very innovative abstract in the subject or the discipline of endovascular surgery. Just a quick disclaimer, I'm not a medical professional or specialized in surgery. I just enthusiastic about this. I'm just enthusiastic about the subject and the abstract that I'm about to share the review with you today. It's regarding the management of patients with symptomatic chronic total occlusion, a very vital subject and controversial that has a lot of medical professional going through a lot of discussions and disagreement with each other regarding this vital matter. Again, uh, the subject or the term CTO is a referral to chronic total occlusion. It's a problem that occurs in the arteries. It's kind of a blockage of the veins around the area, and that requires normally an immediate surgical interference. And the abstract that I'm about to review with you is an overview of the symptomatic chronic total occlusion and best practices in the when a surgical interference is required. The internal carotid artery is controversial, of course, as we have just said. The aim of the systematic review was to investigate patient selection, technical success, early and late outcome of the endovascular treatment for CTO of the ICA, PubMed or Medline and Embase databases were searched until January 2nd, 2020 for studies on endovascular treatment for CTO of the ICA. A descriptive analysis of demographic, clinical, and anatomic data, endovascular technique, perioperative and late outcomes was performed. A total of 1,222 articles were screened. 8 retrospective, prospective cohort studies were reviewed. 276 patients, 18.9% females, mean age 64 years, underwent attempt at endovascular treatment of 278 lessons. 213 patients, 77.2%, had neurological symptoms. The others had evidence of ipsilateral cerebral hyperperfusion. 238 lesions, 91.2% were treated more than 30 days after diagnosis of occlusion. Technical success was 66.9%. Perioperative mortality was 1.64%. 4-243 early stroke rate was 3.3%. Follow-up average 73.4 months. Range 0.25 to 84 months. Late mortality was 1.89%. 5 divided by 265. Stroke rate was 3.4%. 9 divided by stroke rate was similar after successful stenting, 3.57%. 4 divided by 112 versus failed stenting, 3.61%, 2 divided by 61, P equals 1.00. Stroke death rates were also similar after successful stenting, 5.36%, 6 divided by 112. Then after failed stenting, 3.28%, 2 out of 61 patients, at a rate of 0.71 endovascular treatment of CTO of the ICA in 8 cohort studies was safe and feasible with a technical success of 67% and a low rate of early and late neurological complications. Pooled data in this review failed to confirm the benefit of successful stenting on stroke and mortality, but some of the included studies suggest benefit and some also supported improvement in neurocognitive function after successful stenting. Prospective randomized trials to investigate the benefit of endovascular treatment in addition to best medical therapy for symptomatic CTO of the ICA are urgently needed. The keywords: carotid artery stenting, chronic total occlusion, endovascular treatment therapy, internal carotid artery. 2021 Annals of the Translational Medicine was reserved for this abstract. Conflict of interest statement. Conflicts of interest, both authors and the completed ICMJE uniform disclosure form were submitted to the relevant authorities. The serious carotid artery stenosis and stroke prevention and treatment was commissioned by the editorial office without any funding or sponsorship. The authors have no other conflicts of interest. The figures was a diagram that was also published within the abstract. I'm gonna leave a link to the abstract that you can review the diagrams submitted with the abstract. And of course, I'm gonna also link the references that were used throughout the whole process until the submission of the abstract. The numbers and rates that has been published within this abstract refers to relatively low survival rates of these stenting operations that usually leads to a death or damages in the surgical area associated with this fundamental parts that require immediate surgical interference. And that's pretty much the numbers and the outcomes out of this abstract that I wanted to share with you today. And this is the first video of a series that's gonna follow on this video. Hope you like it and that you have pretty benefited from these numbers. whether you're a medical professional or a trainee in the healthcare industry or the healthcare sector. Uh, share with me your inquiries if you have, and let me know if you have any questions to the or further, or if you require further references to the subject. I'll be more than happy to share. And don't forget to leave your opinion. I would appreciate every opinion, even if it's even if it's criticizing uh, the content, or if you don't like the the structure of the abstract. Thanks a lot for sticking around, and usually I hold live sessions that's gonna be on a weekly basis. It's going to be an hour or half an hour, depending on my availability during the respective day. And the subjects of these live sessions would be very spontaneous. It's not prepared. It's not pre-decided. It's going to be just improvised during the live session. And we're gonna make up together a subject that we would like to discuss or get into a discussion or learning about a subject. It's gonna be totally spontaneous and looking forward to it. This thing has been for a long time on my bucket list, and I'm very excited to finally find the time to commit to it. Thanks for watching and sticking around. See you next time.